Meet Arlen, a 67-year-old with known aortic aneurysm and long-standing hypertension who returns to the ED with vague complaints. Notice, Arlen's presentation includes tearing chest and back pain, along with shortness of breath. A blood pressure might show a difference of more than 20 millimeters of mercury between extremities. A CT scan confirms the inner lining of his aorta is tearing and separating from the rest of the arterial wall. Interpret. A dissecting aortic aneurysm occurs when the inner lining of the aorta tears, allowing blood to force its way between the layers of the arterial wall and separate them further. Arlen's years of uncontrolled hypertension placed continuous stress on his already weakened aneurysm, and this chronic pressure ultimately caused the wall to tear. An aortic dissection is known as the great imitator because symptoms can be vague and mimic other conditions. Respond. Immediate priority is aggressively controlling his heart rate, blood pressure, and pain. A goal heart rate is 60 to 80 with a systolic blood pressure less than 120 to prevent further tearing or rupture. If the patient is a surgical candidate, they will be rushed for emergency repair along with large volume blood transfusions to manage blood loss. Time is critical, as advanced dissections carry a poor prognosis even with intervention. Reflect. A dissection can be stabilized with rapid heart rate, blood pressure, and pain control, along with emergency surgery if the patient is a candidate. Without immediate treatment, dissection can quickly progress to full aortic rupture, causing the patient to bleed out within seconds, with no chance of survival. In summary, a dissecting aortic aneurysm is a tear in the inner lining of the aorta that allows blood to separate the arterial wall layers, most often driven by chronic hypertension stressing an existing aneurysm. It presents with sudden tearing chest or back pain, unequal blood pressures, and pulse deficits. It requires immediate heart rate and blood pressure control, along with surgical repair when able, to prevent rupture. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.